Does hyperbaric oxygen therapy accelerate the growth of cancer? For years, some in the medical community thought cancer cells thrived in an oxygen-rich environment until evidence-based studies were conducted to conclude cancer cells do not. This old fear prevented many cancer survivors from receiving hyperbaric oxygen therapy. Recent studies show most cancer tumors thrive in low oxygen or hypoxic environments. For cancer survivors experiencing non-healing wound complications from chemotherapy and the delayed effects of radiation injury, our board-certified physicians deliver hyperbaric oxygen therapy to supersaturate the body with 100% oxygen under pressure. Hyperbaric oxygen therapy unleashes healing benefits that create new pathways for oxygen to get to areas of the body experiencing the delayed effects of radiation treatment that are lacking in oxygen. Build and strengthen collagen for wound healing pre and post surgery, especially for breast reconstruction. Promote the growth and mobilization of stem cells, which stimulates growth factors to assist in healing. Enhance white blood cells to prevent infection and kill bacteria, and reverse the effects of radiation injury in tissues and bone. If you're a cancer survivor, the last one got your attention, right? You can't turn back time on your cancer experience, but you can turn back the effects of radiation damage on your body. Non-invasive hyperbaric oxygen therapy uses life's most essential ingredient to resolve, even reverse the damaging effects radiation therapy has on some patients, months, even years after treatment. Our greatest clinical successes are patients with radiation injuries in the prostate, breast, and head and neck area. Hi, I'm Reagan Holliday, president of Hyox Medical Treatment Center in Atlanta. We specialize in hyperbaric oxygen therapy, an adjunctive, non-invasive treatment tool to advance healing without uncomfortable side effects or use of pharmaceutical drugs. By supersaturating the plasma with 100% oxygen breathed in under pressure in Georgia's largest hyperbaric chamber, we increase the body's oxygen content by up to 1,500%. Hyperbaric oxygen therapy helps regain function, achieve healing, and improve quality of life by reducing debilitating pain, swelling, and healing chronic wounds associated with the delayed effects of radiation injury. Oxygen content in radiated tissues and bones is lost while undergoing radiation therapy, and in some patients, injury is caused in the surrounding area, resulting in soft tissue radionecrosis or osteoradionecrosis. Symptoms include blood in the urine, swelling, severe pain, non-healing wounds, and failed flaps and grafts in a post-reconstruction surgery. If you're a cancer survivor and received radiation treatment recently or years ago, it's important to share with your current care team, especially if you start experiencing any adverse effects. Cancer survivors are motivated to get well and compliant with treatment protocols, which combined with the healing power of hyperbaric oxygen therapy, makes their outcomes extremely successful. Hyperbaric oxygen therapy reverses radiation injury by stimulating blood vessel and cellular growth in the areas damaged by the cancer-killing radiation treatment. This allows bones and soft tissues to heal. For breast, prostate, and head and neck cancer patients, it's protocol to get pre- and post-surgical hyperbaric treatments to increase the viability of the radiated tissues and bones before surgery and advance the healing process after.
Hi, I'm Dr. Hackey here talking to you guys a little bit about hyperbaric oxygen. So the oxygen in the air is about 20%, right? So if you get into what's called a hyperbaric chamber where they have high concentrations of oxygen, it can cause cells to heal quickly. It'll cause wounds to close more rapidly, which is amazing.
HYOX treats a full range of approved and covered cancer-related complications, including the side effects of chemotherapy. A suppressed immune system from chemotherapy can lead to infections and non-healing wounds. Hyperbaric oxygen therapy's healing benefits advance recovery. As we've discussed, delayed effects of radiation injury happen over time because of a loss of oxygen content in radiated tissues and bones. For that reason, we treat many women pre- and post-breast reconstruction surgery with hyperbaric oxygen therapy to better prepare the previously radiated breast for reconstruction. By hyperoxygenating the compromised tissue, we reduce swelling, fibrosis, and ensure surgical flaps and grafts don't fail. For head and neck cancer survivors with a radiated jaw, oral and maxillofacial surgeons and dentists use the evidence-based MARCS protocol for hyperbaric oxygen therapy prior to oral surgeries, including tooth extractions. The protocol continues post-surgery to help support the tissues and bones' metabolic demands for healing. In areas of the body like the pelvic region, blood vessel cell damage and decreased blood flow to the soft tissues from radiation injury are difficult to treat. With adjunctive hyperbaric oxygen therapy, pain, discomfort, and swelling are dramatically reduced, enabling healing in those compromised tissues and prostate cancer and other pelvic malignancies. For more information about cancer complications treated with hyperbaric oxygen therapy, including case studies with photos showing healing progression, please visit hyox.com. And again, if you've had radiation treatment or know someone who is getting treatment for cancer, please make them aware of the healing benefits of hyperbaric oxygen therapy should any complications arise. If you've experienced any delayed effects from radiation injury, please let us know in the comments. How did you heal?